joining us. My name is Julie Kaanapu, and welcome to Pro Health Share, where you can learn healthy lifestyle intelligence from providers in health, and where you can become the healthiest and happiest you. I'm so excited for my guest today, Dr. Donovitz. Thank you so much for being here.
Thanks for having me.
Absolutely. You have a long list of accomplishments, and I want to tell you all a little bit about him. Dr. Donovitz is a board-certified obstetrician gynecologist. He's been caring for patients over 30 years. He's the founder of BioTe Medical and a leading innovator and international lecturer on bioidentical hormone replacement therapy. He's an expert in subcutaneous hormone pellet therapy, having performed close to 60,000 insertions, and is successfully teaching this technique to approximately 3,000 providers across the nation, including Puerto Rico. Additionally, Dr. Donovitz has been a pioneer and trained in robotic surgery, received the Isidore Dyer Award for Best Teaching Residence while at Tulane University, a fellow of the American College of Obstetrics and Gynecology, a fellow of the Royal Society of Medicine, current medical director of the Institute for Hormonal Balance, and author of the best-selling book, Age Healthier, Live Happier. So thank you so much again for being here today and for sharing this.
Good.
So a couple things I want to let the viewers know is you've been successful OB-GYN for years and have been doing pellet therapy, but why did you kind of switch gears and start BioTe?
Well, there was really a need for practitioners to learn hormone replacement therapy in a different way. And really, it was really necessary to understand that hormone replacement therapy actually could be a way for people to change their lives. Not just do hormone replacement, but hormone optimization. And nobody really was optimizing hormones out there. And nobody was training physicians. They didn't get it in residency. They weren't getting it in practice. And most all, they were just learning from the drug reps who were actually giving them the wrong drugs, and they were having all kind of problems. So the patients really never felt better and really never got their life back that they should have. They never felt their best no matter what their age. So BioTe set out to really change healthcare, and the way you change healthcare is to optimize your hormones. Then you don't need all the medications that people were taking, from antidepressants to diet pills and sleeping pills ad infinitum, because those pills really rob you of the quality of life that you deserve. So BioTe set out to do something completely different, and we started with very few doctors and now have 3,000 practitioners. Because of that, we have now set the standard of care for what hormone optimization is and who should really receive it.
That's awesome. So when you say a hormone optimization, when someone's coming to the doctor and you're talking about different medications that they're taking and their hormones are normal, what's the difference? Who might be a candidate, and is it age related?
Right. So normal, I don't know what that means, because you can't expect the lab to know what your hormones need to be. And in fact, for women, there's very little normal values that actually exist. So what you really need to see is what kind of symptoms do they have. And women will start in their 20s, mid-20s, having anxiety, mood swings, they're tired, they don't sleep well, they're gaining weight, can't lose weight even if they work out. They have less sex drive than they used to have, and generally they don't feel well. They have a brain fog, they can't remember things, and they're wondering, what's happening to me? And most people are just putting a Band-Aid on it. Most people are just treating them with medications, which then have side effects. So for us, we are looking for those people in their mid-20s that would benefit from hormone optimization, whether it's testosterone, whether it's thyroid, or whatever. So we actually do a workup to see that. Men, it's going to start in their mid-30s. Very similar symptoms, and again, we'll do a hormone workup on them. So rather than wait till menopause or andropause, like most people are waiting until someone's in their 50s, you're giving up a lot of time when people have felt miserable. And so if we could start earlier and get a handle on hormone optimization earlier, we could prevent a lot of the diseases that are going to rob them of a quality of life they would have later. For instance, heart disease, you got to start early. Alzheimer's disease, again, you need to start early. And dementia, osteoporosis, people start losing bone in their early 20s.
Yeah.
Why wait till they're 60? Because then you have to treat the disease with drugs that actually don't build really good bone, and they're still at risk for fracture. So that's not really so good. And people worry about hormones and the side effects, and maybe we should talk about that.
Yeah, and it's funny you say starting in 20s and 30s, because until maybe about 6 or 7 years ago, where we met, I don't think most people do associate needing hormones prior to menopause. I never thought when I was in my 30s that I would need hormones because I wasn't menopausal. But realizing that women can lose up to 50% of their testosterone before even the age of 40, which helps build bone, protects the heart, right? Brain, breast.
And breast, sure.
And we're losing a lot of that way before menopause even starts.
Right, and so here comes the problem, is people don't realize that testosterone starts decreasing in the mid-20s. Growth hormone starts decreasing in the mid-20s. 40% of the population is really hypothyroid, either regular hypothyroidism or type 2 hypothyroidism, but the thyroid really helps them. It helps with their immune system. It helps with their heart. So if you want to prevent, metabolism. So if you really want to feel your best, you've got to look at all the hormones and make sure each one's optimized. And the very cool thing about what we do at BioTe is we're able to individualize therapy rather than just shotgun therapy. Here's a pill, here's a patch, here's a cream. That's not going to work,
right?
Because everyone's different.
So we're talking about optimizing and how that can help, and so many patients or people that I've talked to, have one doctor that says, yes, absolutely, this is beneficial for you, and know how to optimize and feel confident in that. And then they go to their other provider and they say, no, get off of that, or you shouldn't be doing that.
Right.
Where's the disconnect, and who do they believe?
Well, the disconnect comes from training. And you get very little hormone training in residency. And again, most of it's going to come from drug reps that come to your office. So most drug reps are going to be using synthetic hormones that the big pharmaceutical companies have made that come with a whole host of side effects that bioidentical hormones, and particularly bioidentical hormones delivered in pellets, don't have. And so therein lies the disconnect, because the problem is, for years we focused on the risk of hormones, forgetting all the benefits. And the reason that we focused on the risk was because the media, magazines, the television, everybody else has been out there going, oh, hormones are bad, hormones cause cancer.
Hear the bad news.
Right. And the question is, do all hormones cause that? Or do some hormones actually protect the heart, the breast, the bones? Mm-hmm. And so there is the disconnect. Now, if you're strictly going to use synthetic hormones, you're going to have a problem because the side effects are more and the benefits are less. If you use bioidentical hormones, not taken orally, you can have the benefits with very few side effects. And that's what the patients really need to know. But before the patients get to know, maybe the physicians need to learn that. And that's what BioTe is trying to do. I mean, is to get out there, at least get in front of these physicians and dispel the myths. Mm-hmm. Because it is a myth. And then when they see the data, and everything we do is evidence-based, meaning there are studies to support what we do, mm-hmm. good studies to support what we do, and what we do has been done in Europe and Australia for 80 years. And so everybody else just needs to catch up, because in the United States it's just not that way, but it's getting there.
Yeah, and I didn't realize that pellets have been around since 1939. Like you said, used in 5 different continents around the world.
Right.
It's made a huge difference in my life and my family's and husband's. But what makes it different between a BioTe certified provider, because they come to your trainings, right, and they get extensive training, their staff gets training, they get certified, they do testing, they do clinical and didactic, but what makes it different besides that to another provider who might be doing pellet therapy or just hormone optimization?
Well, so there's all sort of brands or all different kinds of pellet providers, if you will. It's on a spectrum. Some people just buy pellets on the internet. They don't even know how to put them in, so that's a problem. And they have no idea how to dose. For BioTe, we have a proprietary dosing site that will get the hormones optimized first time, 95% of the time. Most people don't have that dosing site. That's a huge problem. Second of all, not all pellets are created equal. Some pellets are not near as sterile as other pellets. If you're going to put pellets in me, I'd want the most sterile pellets and the most pure pellets. So for us, we've got the highest purity, we've got the best sterilization, and the best training. Not only training, but then recurrent training. Because, you can only train so much in a weekend. And so many people go to weekend warrior classes, and in fact, there are some out there in some of these societies that teach, and they're a day-and-a-half course, and they're putting pellets into eggplants. Well, eggplants are not people.
Right.
At our training, we use real live patients, so that when you go home, you have been trained in real live patients with a dosing site that makes sense, understanding the side effects and how to treat those side effects, and your staff has been trained. Because if your staff hasn't been trained, how does your nurse answer the question that the patient has?
Right.
And then you wind up hip shooting, giving people the wrong answers, and then we're down the wrong path again.
Right. Awesome. So someone that would be interested in, okay, I'm starting to feel aging, those symptoms like you're stating, how would they go about, or how would you know if someone might be a candidate?
So a couple things. One, when the people have the symptoms that we talked about, being tired, not sleeping well, low sex drive, decreased sexual performance, gaining weight, brain fog, all those things. The nice thing to do is get your hormones tested, because once we get your hormones tested, we know which hormone is lacking and we can optimize those hormones. We also have a test that we use when you come into the office, and by taking that test we can identify those symptoms. So you may be coming in for the flu or some other symptom, and by taking that test you're like, yeah, I didn't realize that those things were actually fixable. I just thought I was getting old.
Right.
Or I just thought it was something else. So many people, for instance, have a baby, feel bad afterwards, and figure, well, that's just the way I'm supposed to feel. But what if it's not true? And so many people are depressed after having a baby, and they get on antidepressants
without the necessary need of
that can't be
unnecessary
good.
medications.
And that's not good for your family. It's not good for you. It's not going to make you productive at home. How are you going to take care of your baby when you're drugged up? So maybe we should look at hormones in the postpartum period, because that's really where it starts, after people have babies and in their mid-20s, which is when they're having babies.
Right, right. That's awesome. So you've been helping, and all of your certified providers, approximately 30,000 patients every month. What do you, or more than that at least, what have you seen the biggest change that since BioTe's been growing, and what do you want to see maybe 5 years down the road?
Well, a couple things we've seen. One, we've changed lives. Most of the time when you give a person a medication or you just give hormone replacement, they're like, yeah, my hot flashes are gone, my vaginal dryness is gone, or maybe better, but that's not really life-changing. So what we've done is, if people will tell us, hey, you have changed my life. I have a completely different life, my home life's better, my work life's better, so that's one thing. The second thing is, we looked at more than 9,000 women, and we've looked at them now for 9 years, and we looked at their breast cancer incidence. Most women have a high risk for breast cancer. Even in people who've never taken hormones, you would see probably 30 breast cancers per year in that 9,000 population, 9 or 10,000. For us, we've had 12 breast cancers in 9 years.
Wow.
We are preventing breast cancer by doing what we're doing. And people who've had breast cancer who were told never take hormones, we're actually reducing the recurrence of their breast cancer because we do use hormones. Moreover, they feel better. So if you're going to have breast cancer, at least you should feel your best while you're undergoing treatment and then after. Because other people are going to never take hormones, which then puts you at risk for brain problems, heart problems, bone problems. It's unfortunate.
Right. Wow, thank you so much. It's such an amazing journey, and I'm so privileged and honored to be on this with you, and
we're so glad
that we're changing healthcare, absolutely.
Thanks very
so,
much.
Absolutely. If you guys want a copy of Dr. Donovitz's book, Age Healthier, Live Happier, you can find it on Amazon, but better yet, go to biotemedical.com. That's BIOTE medical.com. Click on Find a Provider Near You so you can find out information for yourself and possibly get a free book. Also, make sure to go to prohealthshare.com, become a ProHealth Insider, where you can get weekly information from other professionals in health, because you deserve to be your healthiest and your happiest. Thanks so much for watching. We'll see you next time.